I'm here today to give you some information about coronavirus testing in Red Lake and understanding what the results mean. My name's Jill Anderson and I work at Red Lake Hospital. I've met with both our medical staff and hospital administrators to get the most accurate information to pass along to the community members. Hopefully this answers some questions and eases some fear and anxiety. It's hard when you're dealing with something new. We're still learning and we want to do everything we can to keep you safe. Based on information and recommendations from the Minnesota Department of Health, Red Lake has been testing patients that are presenting with symptoms for coronavirus. As of today, Wednesday, April 29th, we have had 0 positive results. Red Lake is doing the virus lab testing in the hospital and we have results back in about 2 hours. We're working right now to shorten up that time frame even more. We have a very reliable instrument that can run up to 4 tests in 1 hour. We continue to work to increase this testing capacity as well as buying more testing supplies. Right now, we have adequate supplies to meet the testing needs for symptomatic patients and our elders in Red Lake, as well as our healthcare workers here. Now, I'd like to talk to you about how to figure out what the results mean when you get them, and also about some other things you may have heard on the news or social media about testing for the virus. So if you get a positive test for coronavirus, the biggest thing to know is what protective steps to take by following orders from our medical providers here. They decide this based on how severe your symptoms are. Most people don't have to be hospitalized, so they just get better at home with treatment of the symptoms they have. These include similar things you would do if you were home with the flu. Stay home, get rest, drink plenty of water. Keep track of your symptoms and call if you're getting worse, if you're worried you can't take care of yourself, or if you're having trouble breathing. You want to wash your hands often for at least 20 seconds or use hand sanitizer as recommended. And don't share items in your house with others staying there, and clean or disinfect those things you do touch. One thing you probably haven't had to do when you're sick before is to quarantine or separate yourself within your home. You want to try to stay in a specific room and, if possible, use a separate bathroom. If you don't have a room all to yourself, use one of the cloth face coverings when you're around others and clean every object you touch with disinfectant. If you can't do this, have someone who's in charge of taking care of you do it. Now, if you get a negative test for coronavirus, this isn't necessarily an all clear. What it does mean is you probably were not infected at the time your test was taken. However, that doesn't mean you won't get sick. It is possible that you were very early in your infection when your test was collected and that you could test positive later. This is also the case if you have a test done when you aren't showing any symptoms. You could be exposed later and then get sick, just like when the flu is going around. In other words, a negative test result doesn't rule out getting sick later. Keep track of your symptoms. If you still feel ill, even after you may have had a negative test result, call us and let us know so we can make sure you're getting what you need. Now, antibody testing. This has been a hot topic in the news lately. Antibodies are something produced by your immune system about 1 or 2 weeks after an infection, and they stay positive in your system long after the infection. This is why an antibody test can be used to show a past infection with coronavirus. So if you have a mild cough or runny nose or you're still recovering, they have to wait until you recover completely in order to even do this test. So you might ask yourself, well, if I have a positive antibody test, does that mean I have immunity? The answer is we don't know. This is still being studied. So if you falsely assume that someone is immune to coronavirus, this could be dangerous. It might change their behavior and expose them or others to the virus if they aren't still using social distancing of 6 feet or wearing cloth masks like recommended. Right now, federal experts still don't know the role of antibody testing. Just rest assured, please, that we're paying attention to the research and what is recommended. In the coming months, most of the U.S. population will be exposed to this virus, including us in Red Lake. Some will get sick, some will get very sick, and some will get it and never know they had it. You should continue to practice all the protective measures we've recommended to keep yourself and others from being infected. Here at the hospital, we'll continue to update how we're doing our testing according to what is recommended in order to keep everyone in the community as safe as we can. If you have respiratory symptoms like a cough, fever, or shortness of breath, please call to get tested. If you have questions about testing, call us at 679-3912 and just press 1. Miigwech.